ladies and gentlemen, and welcome to the town hall, and welcome to the 113th edition of the town hall, Cameroon Town Hall for Health Professionals. Hello, Brian.
Yeah, hi, Mama, and welcome everyone as well. And it's always great to have you all. And welcome for coming. We are hopeful that today will be more of an interactive sessions. I think that globally we are in the middle of the fourth industrial revolution. We are pretty much in the middle. You might remember the first industrial revolution was characterized by the production of steam, which really mechanized how we produce food and things like that. The second industrial revolution was characterized by the production of electricity, which really scaled how we're able to produce a lot of things, like even agriculture, farming, etc., was really driven by that innovation at the time. Then we had the third industrial revolution, and that was pretty much recent, but that was the introduction of computing. So the ability to the internet of things, computing, etc. And I think it changed a lot. It affected multiple sectors, and every time that we've had an industrial revolution, it has significantly impacted every single sector. So we thought that it would be great for us to have, we don't have an expert person here to talk about the nitty-gritty and details of artificial intelligence, but we thought it would be great to have a one-on-one interaction with you all in terms of how you've been using AI, how you're in your field, if it's being implemented in your field, what sectors do you see those transformation happening, and also spend some time discussing about some of the challenges, specifically for Cameroon, where we might be in terms of digital infrastructure. What do we need to build the kind of, because the United States and China, everyone is competing with GPUs now. We've moved from talking about CPUs, central processing units, to talking about GPUs. In terms of, where is Cameroon standing on that specific landscape? So I know many of you are familiar with many of the large language models that have been deployed, things like ChatGPT, Claude AI, Gemini, Llama, etc., Copilot, etc., which are a subset of artificial intelligence. But we wanted to launch this conversation by really engaging you all to really gauge your experience, how you've been interacting with some of these tools, not only large language models, but whether it's deep learning, whether it's other forms of machine learning algorithms that you've seen deployed, and how you foresee artificial intelligence transforming the healthcare sector, and what possibilities might exist specifically in Cameroon in terms of changing how we should be thinking about healthcare, and especially the healthcare of the future, not the healthcare of today, but how can we leverage the existing technology to better prepare for the future. So I think that's what we sort of had in mind, and we'd really like to invite you all to engage in these conversations as we try to untangle some of these things. And if you have thought, you shouldn't hesitate to raise your hand, or to you can use the chat feature as well to drop your chat. I initially thought that it would be great to do some PowerPoint presentation, but I want to admit here that although I've read a lot about AI and understand how the systems work intricately, I'm personally not an expert in it. I'm still really disentangling it to really understand how the systems really work. It's very complex, but I'm really curious about how each of you have been experiencing, what your experience has been. So, Dr. Mona, it's a pleasure. I think it's a very important topic. I have no doubt that there's any sector that wouldn't be left unaffected. That's what we saw with the previous industrial revolution. It affected every single sector. I won't say there's any agency or or industry or business that's not affected by computer, for example, or electricity. Everyone uses electricity or computers, for example. I think it has facilitated how we do a lot of things. And I see this as being, well, we are pretty much in the middle of another one. And I think that the scale of this one is even bigger. So I'd love to hear your thoughts as well. And as a provider, how have you seen it revolutionizing how you take care of your patients, etc.? The challenges there, I know there are lots of ethical data security, ethical issues and ethical considerations, data security consideration, liability issues, and things like that. So I'm really also really curious about how we should be thinking about this and how we should navigate some of those challenges. Dr. Mona.
Yeah, Brian, I think this to me is one of the most important revolutions that have happened in the last 100 years. So it's going to AI, and the reason we brought this up, and as the year goes by, we have very few people who can really say they are experts in AI. We're trying to source out some of them who will be able to tell us. A lot of them are actually found in the technological world who are designing some of these programs. But going back to your question about how AI has been integrated into the practice I do, or the practice of medicine, the reason I say AI is, to me, is one of those tools that is going to breach the first world countries, so-called first world countries, the developing countries, and the underdeveloped countries. It's going to take us 100 years in less than a month. I always say this jokingly. Why? Because think about it, Brian. You were trying to design, I think both of us spoke about the alpha model in protein designation. We're trying to look at the guys who won the prize, the Nobel Prize. You're trying to predict how proteins are going to be able to create maybe certain drugs. In their case, we want to create new antibiotics. And we study protein structures and we study receptors in order for us to design maybe monoclonal antibodies for those receptors. It takes pharmaceutical companies years to keep trying one drug after the other and designing them. At the moment, we can fit an AI model with all of this information, and they will be able to design us proteins that do exist, proteins that could exist, and proteins in the future that can actually target that area. A research that could have taken us maybe 100 years will take us less than a few months to get, in order for us to really see these predictions come to life. These are things that are happening. They are happening in proteomics. They are happening in DNA analysis. They are happening in RNA prediction models. These are all examples of prediction models. I'll tell you, one of the things I saw that AI has really made a difference for us, as physicians in the US and also in Africa, the biggest burden where we do have what we call physician burnout is preparing to see my patient. And let's say preparation. I have a patient who comes to me. A patient was just transferred and brought to my office and has records for almost 10 years of cancer treatment records. Can you imagine me reading through all those records and trying to figure out what has been going on? Do you know what the AI model can do? AI models like ChatGPT and others, Gemini, they are good at summarizing data. So preparing you and giving you a summary of what has happened in the past 20 years. Just highlighting this patient has had this chemotherapy for this duration, summarizing everything. So that is one of the uses of AI, which I find is basic, because it's one of the basic tenets of how artificial intelligence works, gathers data and analyzes them. So that's one way we have seen it really help us. The second thing I've seen in the AI revolution is logging in the records itself. Like getting the records in, logging the records. Let's say I'm seeing a patient today. This is what is happening already, Brian. And this is where we need to understand this, what is happening. I use a scribe in my practice, but we have AI scribes. What does an AI scribe do? I don't use an AI scribe right now. There are several models that are being designed, and I want to talk about this so that Those who are young in Cameroon can know these are things that are happening. I'm having an interaction with a patient for 30 minutes. I'm just talking to the patient. The AI is listening. And the AI is able to listen and pick up pertinent medical information. And by picking up the pertinent medical information, is able to summarize it and actually chart a note and be able to say, okay, past medical history, this is what was gotten. History of presenting complaint, this is what was gotten. History of past illnesses, past surgery, is going to chart down that whole information and produce you a patient's chart that you can review. And you can just edit it. That's logging records. And I can spend time talking to my patient and having a human feeling. The other thing which we are not good at, like in oncology, there is research coming out every day. Brian, you know that. There is no field in medicine that has research, and it's applicable in Cameroon, like oncology. Things change. We have multiple clinical trials. AI is able to get data and actually analyze it with the recent research. Let's say I have a patient in front of me. I'm seeing him for melanoma, and we have new research coming out, and he knows my diagnosis is stage 4 melanoma. I'm able for AI to tell me what happened in ASCO, what happened in ESMO, what happened in maybe a melanoma conference recently, ASCO, and summarize the most recent data that is available and which I can use for this patient's treatment. These are live applications that are taking place. And these are things you can use AI for. If you only know, the question is, we have a tool. The question is, how do we embrace the tool? There are others who feel that we are here to take the jobs of physicians. No, neither are we here to take the jobs of nurses. We're here to make things easier. We may take some people's jobs if they are not going to be able to embrace it. I have seen AI being used in radiology a lot. I'll give you an example. Radiologists have been using, a lot of us would ask, what is AI? Artificial intelligence. You could say Siri is a form of AI. Google is a form of AI. Gemini, ChatGPT, all of those things, they are different forms. But radiology has been using AI in order to analyze images. It has been shown that AI models are able to pick up cancer and lesions in the lungs with a 99% confidence interval. Can you imagine that? When they're well trained. From CT scans, from brain MRIs, reading it and all of that, they're able to do that. It has also been shown that AI models can be educated to read an EKG with thousands of EKG. They are not only to predict that you have AFib and all, they can actually predict that patients are diabetic. They can actually predict with accuracy that patients have congestive heart failure. They can actually predict your race. They can predict so many things after you've fed them with thousands and thousands of information. We have had models that when I speak to some radiologists, they are able to tell you, AI models that are able to take low resolution images and make them high resolution images just by after getting thousands of data. So this application is totally the future, as you said. So it's not really to replace doctors, it's actually to help them. Throughout this whole process, I've seen a few other things that happen, like there are certain biases. You can know when you Google during the elections, you're Googling anything about Trump, maybe you get a promotion of Harris coming out. I don't know, stuff. You get things like that happening. Those things are our biases that do exist, and our biases can be fed into AI models. That's why still we need to make sure that data that gets into AI models are not biased towards either the left or the right, because it's going to produce the outcome is also going to be as trashy as that. We have to make sure that this data is also an open source so that others can verify how the coding is done. I'm not a coder. As you said, Brian, there's an issue of privacy, which is a big issue. There's an issue of accountability, especially in medicine. Should I be able to put in a patient's data into ChatGPT? Where does it go to? Where is it stored? Is it safe? Is it violation of HIPAA regulations? What are the accountabilities that we have? Issues of safety. Then there is what we call data hallucination. I don't know if you've noticed it. I used a lot of ChatGPT. Data hallucination is that ChatGPT in itself can be very confident in telling you lies. So there is sometimes something is really a lie. It can confabulate, it can create data and justify it. I don't know, Brian, I would ask your opinion about that, but those are things that you could see, especially if you're knowledgeable enough to see that, especially in areas where it's new. You could ask it, okay, tell me what is the new treatment that is available maybe for lung cancer that just came out in this journal. When it's not even there, it's going to search and may actually create something that is not existing. So we have gotten to a point where the use of AI, I'm just citing, I'm a novice in this field, Brian. So there are multiple applications, but in the field of medicine, it's just totally, we're still looking at the tip of the iceberg, and medication designing new antibiotics, new medications, that's the field. Diagnostic medical errors. In the US, diagnostic medical errors is responsible for more deaths than most other things. Can AI help us with that? Can AI actually analyze this data and help us with diagnostic models in order to actually diagnose patients accurately when they fit them with different information? And I think AI can do that. There's just so many things going on, Brian. So that's my little input I wanted to say. I think it's a field where we need to understand what is going on and be able to see how we can apply it back home.
All right, thanks, Mona. I think you touched, before I call on some people in the audience, I think you touched on some very, very important points, and I just wanted to circle back on some of those. The first one you referenced or mentioned was the alpha folding protein. Are you concerned that the model, I know the Nobel Prize was awarded for it, but are you concerned that that became open source? And what are your, are you concerned that if it's placed in the hands of some malicious actors, someone could design a protein that could, or a virus, for instance, that is perfectly suited to a specific human receptor that could spur like a new pandemic and things like that? So kind of curious, I mean, we see the optimism in it, but are you concerned about that? And which, when you think about this, Dr. Mona, what governing structure do you think should be in charge of the regulation of AI? I think the United States is still behind. It's just last month that the FDA sent out guidelines on how AI should be used in biomedical research and things like that. That was just pretty recent. I know the European Union has been doing some work on that, and they sent out some guidelines several months ago. But I'm curious your thoughts around who should be the governing structure that regulates what is acceptable use of AI and what isn't?
Yeah, Brian, those are very difficult questions. First one is, am I concerned? Yes. Like every other technology on earth can be used positively or negatively. And if we're able to take science that originally could be done by the human brain, could be done in maybe 100 years and compute it in less than a week or two with huge computers, we will be able to discover a lot of things. We'll be able to discover things that, depending on each and every scientist's interest, people could design medications to help treat cancers, which that's what I do. People could design medications to help treat different diseases that we know what the receptors are. We can also be able to create proteins that would help explain diseases like Alzheimer's and other things, and the foldings and what happens and how to prevent all of these things that are happening. But others could also be in the process of actually genetically modifying viruses faster, easier, without actually even needing to go to school. Because you can imagine what AI does. Like right now, I always give a simple example. You needed to be a computer engineer in order to design a game and run it on Java, which is going to be able, or on any of these platforms, which will be able to play on your computer and all of that. Now you don't need to be a computer engineer. You just need to tell ChatGPT exactly how you want your game to be designed. And it's gonna spit out a code, which you take that code and design. So same thing is gonna happen with these proteins that are open source. You just need to be able to put it in and tell them, okay, I want to design this time around. You don't even need to be a biochemical engineer. You need to have very little amount of knowledge about what is going on, and you'll be able to create marvels. So being in the wrong hands and bridging the gap between the scientific world and the layman, because what AI does is it puts science into layman language. You're just giving instructions on what it should do. And it has the background to be able to run through all those protons, the DNA, the RNA, even if you don't understand what an amino acid is, and actually design you something that at the end of the day could end up being malicious. So regulations, to regulate or not to regulate, is always a very big question. Now, guidelines, there are some guidelines. The European Union is ahead of the US. And I think we need, I'm one of those who is in the middle of all of this. I think regulations are needed, but how strong the regulation should not be in such a way that it actually inhibits science progress. Who should do this? Which governing organization should do this? Brian, it becomes very tricky, and there are several hands that are up. I would like to hear from others. And I know Sandrine's hand is up and all of that, and you have Can. These are showing a lot of interest in this topic. So who should regulate? This has been one of the big problems in even designing it in the future. I just had a meeting at our job site. We're talking about different models. And my real question was, even with using virtual scribes, do we have guidelines in the US? How does it affect HIPAA regulations? Where does this data get stored? Is it HIPAA safe? Are all of these things really, which organization? I think they should create. That's going to be mine. I think they should go back to the UN, and the UN should be able to mandate some rules that are going to be signed by all the countries, some ethical principles that should be in place, like we did for the nuclear bomb, some ethical principles in place where we're going to integrate and be able to help control the proliferation of AI information without making sure that we lead to malicious uses of AI. We can't prevent it, others will use it that way. But as I said in the beginning, government structures, I don't know, Brian, who else, but I think we need something bigger than a country. We need something bigger than a country. I think this needs to go to the UN. It's a big thing that people don't know about that's going to happen. There's going to be a seismic shift in the way things are done. But to me, Africa is the biggest benefiter of this whole thing going on. It would take our young generation, will bring them 200 years ahead of where they would have been by having access to AI and using it. 200 years. And if we embrace it, I can't tell you how much strength Africa can develop by just embracing the things I do with ChatGPT. If I imagine what a medical student can do with it, with the paid version, to me is very amazing.
Thanks a lot, Man. I think we'll just circle through some of the hands that are up, and I really would like to hear from everyone in the audience in terms of how you're seeing it being applied in your own industries and some potential areas where you think Cameroon can invest. I'm trying to find the document. I think we shared it. So if someone has it and can drop it in the chat, the digital plan strategy that the Ministry of Health released, I think last year or something. I just wanted to see if what the plan there was, if they had made any mention. I know someone has shared it in the chat here before, but if someone has it and can share it again, that would be great in the chat. Matt Polo, please.
Thank you, Brian. This is a great topic, has a lot of interest. I just want to follow on what Dr. Mono said. I think I agree with him that there needs to be regulation, but the regulation needs to have teeth. And the UN actually adopted a landmark resolution, I think in March this year, with some guidelines on promoting safer AI applications. And I think 120 countries actually signed it. The issue with that is you have AI advancing very fast, at least in the medical field, but there is no counteractive measure other AI tools, at least not enough to really look at an AI output and say this came from artificial intelligence models. We need also people to work on those type of initiatives where, as much as we want to advance in science, we need to have detectors of products from AIs. So that will help the regulators and it will help enforce also the rules. The second thing I also wanted to discuss is who's going to pay for it. Dr. Mono discussed about AI, Scribe AI, which is a good thing. And I always think if something is introduced, someone is putting effort in developing it, even if it's open source. And if we want some sustainability, someone has to pay for it. Is it the patients in the US? I think what I observe, at least in North America, is that it's put in the bill, but it's not a line item in your medical bill. So the hospital gets a contract with a vendor, and then the hospital will increase the prices, but you're not going to see it. We talk a lot about AI listening, which I think that's what Dr. Mono referred to when you have a conversation with a patient and you have an AI listening. This is great, but one of the issue with that, at least, is the fact someone can actually get access to those records who's not allowed to have access to it. And I believe those technology, they needs to also get consent of the patient. If the patient wants some area of those conversation redacted, he has that right, which actually it's going to remove from the original transcript. So if the patient said this part, I don't want it to be transcribed, then the doctor has to go back to write a script or take medical notes. So I'm just fearing those technology might just, and no offense to anyone here, might just help us forget our skills of note-taking. So the third piece, it's really related to Cameroon. I think Brian mentioned he would like to hear from how those AI models can be applied to our industry or even in our country in healthcare. I think one area I see is really note-taking. In Cameroon, as you all know, many people, doctors actually write notes. It's all handwritten notes. And for AI to be trained, you need data in a digitalized form. So when we think about Cameroon, maybe we should start first by using an AI to digitalize the handwritten notes. And then we can think about other applications, like we talk about a diagnosis of medical errors. So the last piece I want to contribute is around financing. If you think about Cameroon, the way it's done, usually for patients, they go to see their doctors, they get a prescription, they go to a pharmacy, they may or may not find the drugs they want. Why don't we think about a system which can actually understand what is being prescribed at the local level, at the national level, and do tendering for medicines? So this will enable to save cost. Again, I come back to the issue of financing. We need to know how to finance those models. But a great example in Cameroon is just to see how can we actually apply those models to facilitate the work of doctors in terms of taking medical notes. And the second piece, really understanding how we can decrease the cost of medicine by having an intelligent way of understanding what is being prescribed and what is being available in the country. Thank you.
Thanks a lot, Dr. Polo. I think you touched on some really critical points, and one of the things you mentioned reminded me of this scary paper I read in Nature. I'll just put the link in the chat. And essentially what the authors, the argument the authors of this study were making was that if AI models are recursively trained on AI-generated content, humanity might become dumber or lose our critical thinking ability. So when you were talking about losing the ability to take notes, or physicians losing the ability to take notes because they have all these AI tools, and not using that creative component, that innovative component of our brain, is that where we're going to live? Because that's really what the argument the authors were making was, we might reach a point where most of the content, and I would probably argue that most of the written content in blogs and articles, etc., are sort of generated with some sort of the help of artificial intelligence. So if we are saturating the internet with that, and AI models are being recursively trained on AI generating content, you have a point where you have a bell curve, and all the information that's out there is pretty much on the peak of the bell curve, and we are losing on the tail ends of the bell curve. So our creativity may be lodged within the tail ends of that bell curve. So I think that's what the authors were trying to, that's what the authors of this paper was trying to make. And I just would like to encourage most of you all to read that article. I think it was deeply insightful and also frightening. And I think there are others, scientists from Google, Anthropic, and OpenAI, that have raised similar concerns around recursive data use. So I totally agree with you, Dr. Madpolo. And I think that's one scary part, that critical thinking capabilities that we have, etc. So thanks a lot for raising that. You also mentioned the issues around cost as well. Again, I'm trying to find that digital document that the ministry put out, what the plan was. I'm not sure what the digital infrastructure is. I don't know how much GPUs, for instance, computing resources that Cameroon can afford, because that's the biggest issue right now. That's what countries are all competing for, having in place a computing infrastructure that would enable them to train their own models and things like that. So I think that's where most of the competition is probably currently going on. But thanks a lot. Thanks a lot, Dr. Mon. I don't know if you have any comments on some of the points that Dr. Polo raised.
No, Dr. Polo raised very pertinent points. The only way it's always about ethical issues, really. Like, we're listening to patients. How ethical is it? How do we train these models in such a way that we respect ethical principles, let's say in medicine, where I practice, where the notes are going to be as ethical as possible. So all of this is just one of the things I would love to share. Is a very interesting talk. It's going to be about 10 to 15 minutes. I just wanted others to listen to it. It's an interesting talk. That was part of the things we don't have. I don't know of very reputable, what do I call, experts in the field. Here, this is a cardiologist that I know very well. And he gave a talk on TED, which is just, I hope, Brian, if my computer, I'm in the hospital, if my internet is not good, I want you to share this. Oh, but let me share it and see.
I've had the real fortune of working at Scripps Research for the last 17 years. It's the largest nonprofit biomedical institution in the country. And I've watched some of my colleagues who have spent 2 to 3 years to define the crystal 3D structure of a protein. Well, now that can be done in 2 or 3 minutes. And that's because of the work of AlphaFold, which is a derivative of DeepMind, Demis Hassabis, and John Jumper, recognized by the American Nobel Prize in September. What's interesting, this work, which is taking the amino acid sequence in one dimension and predicting the three-dimensional protein at atomic level, is now inspired many other of these protein structure prediction models, as well as RNA and antibodies, and even being able to pick up all the missense mutations in the genome. And even being able to come up with proteins that have never been invented before, don't exist in nature. Now, the only thing I think about this is it was a transformer model, we'll talk about that in a moment, in this award. Since Demis and John and their team of 30 scientists don't understand how the transformer model works, shouldn't the AI get an asterisk as part of that award? I'm going to switch from life science, which has been its biggest contribution just reviewed, to medicine. And in the medical community, the thing that we don't talk much about are diagnostic medical errors. And according to the National Academy of Medicine, all of us will experience at least one in our lifetime. And we know from a recent Johns Hopkins study that these errors have led to 800,000 Americans dead or seriously disabled each year. So this is a big problem. And the question is, can AI help us? And you keep hearing about the term precision medicine. Well, if you keep making the same mistake over and over again, that's very precise. Yeah, we don't need that. We need accuracy and precision medicine. So can we get there? Well, this is a picture of the retina. And this was the first major hint, training 100,000 images with supervised learning. Could the machine see things that people couldn't see? And so the question was to the retinal experts, is this from a man or a woman? And the chance of getting it accurate was 50%. But the AI got it right 97%. So that training, the features are not even fully defined of how that was possible. Well, that gets then to all of medical images. This is just representative, the chest X-ray. And in fact, with the chest X-ray, the ability here for the AI to pick up the radiologist, expert radiologist, missing the nodule, which turned out to be picked up by the AI as cancerous. And this is, of course, representative of all of medical scans, whether it's CT scans, MRI, ultrasound, that through supervised learning of large, labeled, annotated data sets, we can see AI do at least as well, if not better, than expert physicians. And 21 randomized trials of picking up polyps, machine vision during colonoscopy, have all shown that polyps are picked up better with the aid of machine vision than by the gastroenterologist alone, especially as the day goes on, later in the day, interestingly. We don't know whether picking up all these additional polyps changes the natural history of cancers, but it tells you about machine eyes, the power of machine eyes. Now, that was interesting, but now still with deep learning models, not transformer models, we've seen and learned that the ability for computer vision to pick up things that human eyes can't see is quite remarkable. Here's the retina. Picking up the control of diabetes and blood pressure, kidney disease, liver and gallbladder disease, the heart calcium score, which you would normally get through a scan of the heart, Alzheimer's disease before any clinical symptoms have been manifest, predicting heart attacks and strokes, hyperlipidemia, and 7 years before any symptoms of Parkinson's disease to pick that up. Now, this is interesting because in the future, we'll be taking pictures of our retina as checkups. This is the gateway to almost every system in the body. It's really striking, and we'll come back to this because each one of these studies was done with tens or 100,000s of images with supervised learning, and they're all separate studies by different investigators. Now, as a cardiologist, I love to read cardiograms. I've been doing it for over 30 years. But I couldn't see these things, like the age and the sex of the patient, or the ejection fraction of the heart, making difficult diagnoses that are frequently missed, the anemia of the patient, that is the hemoglobin to the decimal point, predicting whether a person who's never had atrial fibrillation or stroke from the ECG, whether that's going to likely occur. Diabetes, the diagnosis of diabetes and pre-diabetes from the cardiogram, the feeling pressure of the heart, hyperthyroidism, and kidney disease. Imagine getting an electrocardiogram to tell you about all these other things, not really so much about the heart. Then there's the chest X-ray. Who would have guessed that we could accurately determine the race of the patient, no less the ethical implications of that from a chest X-ray through machine eyes? And interestingly, picking up the diagnosis of diabetes as well as how well the diabetes is controlled through the chest X-ray. And of course, so many different parameters about the heart, which we could never, radiologists or cardiologists could never be able to come up with, but machine vision can do it. Pathologists often argue about a slide, about what does it really show. But with this ability of machine eyes, the driver genomic mutations of the cancer can be defined, no less the structural copy number variants that are accounting or present in that tumor. Also, where is that tumor coming from? For many patients, we don't know, but it can be determined through AI. And also the prognosis of the patient, just from the slide, by all of the training. Again, this is all just convolutional neural networks, not transformer models. So when we go from the deep neural networks to transformer models, this classic preprint, one of the most cited preprints ever, attention is all you need, the ability to now be able to look at many more items, whether it be language or images, and be able to put this in context, setting up a transformational progress in many fields. The prototype is the outgrowth of this is GPT-4. With over 1 trillion connections, our human brain has 100 trillion connections or parameters. But 1 trillion, just think of all the information knowledge that's packed into those 1 trillion. And interestingly, this is now multimodal with language, with images, with speech. And it involves a massive amount of graphic processing units, and it's with self-supervised learning, which is a big bottleneck in medicine because we can't get experts to label images. This can be done with self-supervised learning. So what does this set up in medicine? It sets up, for example, keyboard liberation. The one thing that both doctors, clinicians, and patients would like to see. Everyone hates being data clerks as clinicians. And patients would like to see their doctor when they finally have the visit they've waited for a long time. So the ability to change the face-to-face contact is just one step along the way by having the liberation from keyboards with synthetic notes that are derived from the conversation, and then all the downstream normal data clerk functions that are done often off hours. Now we're seeing in health systems across the United States where people, physicians are saving many hours of time and heading towards ultimately keyboard liberation. We recently published with the group at Moorfield's Eye Institute led by Pierce Keene, the first foundation model in medicine from the retina. And remember those 8 different things that were all done by separate studies? This was all done with one model. This is with 1.6 million retinal images predicting all these different outcome likelihoods. And this is all open source, which is, of course, really important that others can build on these models. Now, I just want to review a couple of really interesting patients. Andrew, who is now 6 years old, he had 3 years of relentlessly increasing pain, arrested growth. His gait suffered with a dragging of his left foot. He had severe headaches. He went to 17 doctors over 3 years. His mother then entered all his symptoms into ChatGPT. It made the diagnosis of occult spina bifida, which meant he had a tethered spinal cord that was missed by all 17 doctors over 3 years. He's had surgery to release the cord. He's now perfectly healthy. This is a patient that was sent to me who was suffering with what she was told long COVID. She saw many different physicians, neurologists, and her sister ended all her symptoms after getting nowhere, no treatment for long COVID. There is no treatment validated. And her sister put all her symptoms into ChatGPT and found out it actually was not long COVID. She had limbic encephalitis, which is treatable. She was treated, and now she's doing extremely well. But these are not just anecdotes anymore. 70 very difficult cases that are the clinical pathologic conferences at the New England Journal of Medicine were compared to GPT-4.
Oh, okay, it's a connection issue.
The chatbot did as well or better than the expert master clinicians in making the diagnosis. So I just want to close with a recent conversation with my fellow. Medicine is still an apprenticeship, and Andrew Cho is 30 years old. In his second year of cardiology fellowship, we see all patients together in the clinic. And at the end of clinic the other day, I sat down and said to him, Andrew, you are so lucky. You're going to be practicing medicine in an era of keyboard liberation. You're going to be connecting with patients the way we haven't done for decades. That is, the ability to have the note and the work from the conversation to drive things like pre-authorization, billing, prescriptions for future appointments, all the things that we do, including nudges to the patient. For example, did you get your blood pressure checks and what did they show, and all that coming back to you. But much more than that, the help with making diagnoses and the gift of time, that having all the data of a patient that's all teed up before even seeing the patient, and all this support changes the future of the patient-doctor relationship, bringing in the gift of time. So this is really exciting. I said to Andrew, everything has to be validated, of course, that the benefit greatly outweighs any risk, but it is really a remarkable time, and for the future of healthcare, it's so damn exciting. Thank you.
Yeah, Dr. Mono, thanks a lot for sharing that. I think Eric Tupor is arguably one of the smartest, I would say, physician scientists. I have tremendous respect for him. I just don't know how he juggles his time to know so much about different fields.
Language models is
It's okay. Yeah, it's
Stop sharing.
yeah, you stop sharing. Yeah.
Good.
Yeah, so thanks a lot for sharing it. I think that was really insightful. I have a lot of respect for Eric Topol. He's a very insightful physician scientist, and he's very, very active in terms of making available evidence-based, but particularly publications, new publications that are coming out, particularly in AI. I think he's taken very special interest in precision medicine and AI. So I wanted to maybe get some feedback, but I was just informed that Julie Mason was here. I really would love to hear your take on some of the themes that Dr. Eric Topol raised, and really how you're processing this, and also potentially how some of how you process some of these, and potentially how some of those key themes could be beneficial for us in Cameroon. So I really would like to, and thanks a lot for joining us. Maybe we should have extended an invitation for you to talk about this topic. So we're probably looking forward to that. But I would love to hear your thoughts after this. But I want to hear from Khan. I see your hand has been up. So please, you have the floor, Khan. Maybe you make your remarks brief while we wait on Julie. Khan, please.
All right. Thank you so much, Brian, and very good evening to everyone in the house. I think this is a very exciting topic, and it's something I really find interest in. And each time I read about AI, it only reminds me that I know nothing about AI. And I've been very particular about AI in the field of health. And one place to start with is have read the terms and references of about 122 different AI softwares, free. And there is one thing I can conclude from there. They will always let you know that AI is not a human, and it is prone to errors. And that's just to tell us that even if AI has lapses, it is not humanized as we talk about. So there are places where it may actually not suit the context. And I think one of the places is in the healthcare domain, where people were asking, can AI be emotional? How can it detect emotions and things like that? And I think Elon Musk is struggling to model a certain AI that has some facial abilities. It can pick up signals from your face impulses and be able to read your mood. Are you happy? Are you angry? But the next question is, what if you are struggling to contain it within? Let's not go far. Let's just go into our chat. You will discover something. Myself and Sam, we are using one AI called Otter AI, and the AI was able to dictate that we were playing a video and none of us were talking. And if you go to the chat, you will see what the AI wrote. It's quiet here. Are you all alone? I will be leaving in 1 minute unless I hear someone talking. Now, that is the ability of AI, and that AI helps me take notes. Even if I don't attend this call, I can send AI to the Otter AI to pick up the notes for me. And one thing it does is, when I was talking about notes taking, I want to say that if you have used Otter AI, the guy is really smart. It picks the notes, it transcribes what everybody says, and it even selects some slides. I mean, it looks through your presentation and picks some key slides and makes summary of it. And I can be able to sit behind and understand basically what happened in this call without me being present. So the sensitivity of AI only keeps improving. Last year, I happened to participate in a research with Apple where they were struggling to, They were struggling to do model a new smartwatch. And I was asking them that, why is AI open source? And they told me that you cannot monopolize technology. And the more it is open, is the more other people may have ideas which even fall beyond yours, to make it very better. And that has really gone very far in such a way that it is difficult now for people to really, or for the government agencies to control AI, especially in the health sector, because the idea has gone. And I think it was just about the year 2022 that we started hearing about AI. That I discovered that AI had existed for ages before that certain boom of the word AI. If you had used Microsoft Excel or Word in 2016, you will discover that when you type a word erroneously, it is able to read your sentence and then suggest the possible correct words as a replacement. That is AI. What about Excel being able to tell you that, no, this formula has a problem here, it should be this. This plus this times this gives you this. That is AI. So AI had actually existed for ages, and it was only 2022 that this became so very prominent. Now, back into the healthcare, I think AI is more of something that
Since
it
we
can
have
only improve.
I would like you to round up, since we have a few people that I really wanted to call. I would appreciate if you could round up on your reflection.
Yes. Thank you. So I think AI is really something in the health industry that we can only work with time. I've learned that we cannot fight technology, and most of these AIs are integrative. I would like to use just an example of the Wasopito. I think Dr. Alex once spoke to us here about Wasopito, which is an application that you can consult from everywhere. Now, Mono said it can actually bring us 20 years ahead of time, which I agree. Last 3 months, I think the CEO of Wasopita was in France with Macron in a show organized by Orange for African startups. And right there, Macron was able to communicate with a doctor in Cameroon, which means AI will really help in the healthcare industry. A doctor in South Africa can consult a patient in Cameroon without actually moving. It reduces cost. So I want to think that basically what AI does is that it reduces the time to act, just like Dr. Eric said. But on the other hand, too, it is becoming like a cryptocurrency. I don't really know how much we can have control over. Thank you so much, and that's it from my end.
Yeah, thanks a lot, Ken, and thanks a lot for bringing all those points. Thanks a lot. I have a sense that most of the time when we talk about AI, we're kind of narrowing it down to large language models, which is a very which is a subset, really a significant subset of all of this. So I just wanted to call on Julie. Maybe you can help us untangle some of these concepts for us, and maybe help us to I know you have more experience and more knowledge on this than many of us. I'd love if you could share, take a moment to share some of your thoughts on this, untangle some of these fundamental concepts around AI and machine learning and deep learning and neural networks and all this natural language processing that we hear about, and maybe for us to understand. And also, I really would love to hear your thoughts on some of the themes that Dr. Eric Topol mentioned during his during the presentation that Dr. Mono shared. Dr. Julie.
I'm not a doctor, but thank you for the assumption. My elder sisters are, so they get to have that title. But thanks for inviting me to speak. Hi everybody. And the additional tiny context is I've been a data scientist since 2017. But there's still so much more to know in the field, and there's been a lot of evolution around data science, to everybody's points. I am going to try to make people feel comfortable about AI. So as I started learning about AI, I wasn't officially trained as a data scientist. So when I went to school, data science wasn't actually something that we learned, or that was even like an offered major, and now it is. So at the time I was an electrical engineer who really liked math. And then eventually for my master's, I did electrical engineering and computer science. But I looked for data everywhere I was working, and that's how I came into the data science field once it became more popular. One thing that I noticed as I was going through this process is there are some parts of AI that are things that people already know. So linear regression, for example, is just like if you have a XY graph, like a line that fits points on an XY graph, but now it has the name of linear regression, right? So there are multiple parts of AI that have just existed for a really long time, but now we have a lot more computing capability to be able to just do some of these models a lot quicker. So things that we learned before, we're just able to do a lot faster with more computing resources. I would say AI overall, there's AI, there's natural language processing, there's LLMs, multiple different like categories of things. I can maybe like send a graph or maybe pull up one of my favorite graphs or so of how things intersect. But one of the main principles is how do you get machines to operate and think like a human being? Of course, they're not at the point of being a full human being at this point in time, but there's been consecutive process towards helping machines reason more without being explicitly programmed. So in the past, you say like, oh, when you see X and you see Y, do this. And with AI, there's an increasing place where you just say, oh, I just want you to calculate this formula for me, and it just does it without you explicitly programming it. So that's where like AI is evolving as something that's not explicitly programmed, but increases reasoning. I feel like that's a pretty rudimentary description, but if you have more questions, please feel free to ask. And then I did want to focus more on I wanted to emphasize that the models to work on AI have existed for some time. We now have better capabilities. The implications are really neatly spelled out in the TED Talk that we just watched. And there are a lot of positive potential implications for Cameroon. But as somebody mentioned, I joined late and I apologize. As somebody mentioned earlier when I joined, there might be some current constraints with, do we even have the computers, the computing capability in Cameroon to be able to like enjoy the benefits of AI. For a bit though, let's make the assumption that we did. I would love to double down on some of the things that were in the TED Talk. One of the things, whether it's in Cameroon or in the US, so currently I'm a data scientist in a healthcare startup, and there are many providers who, whether they're all the way from a nurse, a PA, an oncologist, and whichever specialty, spend a lot of time taking notes. And you do have to take notes because like you do need to be able to communicate what is happening to a patient. And that just takes up so much of people's time. And we have seen through tools that either have been developed externally or that we're getting to use within our workforce, that you can use AI to help people not have to spend their time taking care of a patient on the notes part of things, which requires you to remember things from maybe like a 1 hour long conversation. So instead of like trying to remember and not be flawed as you're recollecting what happened in that 1 hour, AI is able to help you have some improvements in improvements in terms of efficiency and actual recollection of what happened while you were taking care of a patient. One of the things that I will call out, especially as AI is always improving. So until a company or an entity or an organization feels like the AI that they're using at some point in time is like 99% accurate or at least better than the average performance of their doctors, it's always good to test. Like it's always good to like as you're introducing a new AI that's supposed to, for example, take notes for you, you have to have providers still just scan through and say like, no, the AI took notes, but I'm not just going to say that the AI's notes are perfect. I will now go back and do a yes, this looks accurate, or no, this doesn't look accurate, and keep training the AI to be better instead of just saying like, oh, we now have a new device or a new system to do this work for us, and we're just going to let it do those things. And I see this in part as somebody who's very focused right now on experimenting. When you launch new features, you can't assume that something that was built somewhere that's not necessary for your use case will work for your use case. So let's say a tool was built for healthcare issues in the US. There are some different, like malaria is not going to be prevalent in the US, but malaria might be prevalent. It will be prevalent in Cameroon. So you can't just plug something from the US and then assume the AI would work locally. And so there are these considerations. So this is one of the examples where I see AI being very effective. And another one that's, again, just in the context, I'll just focus on a couple of other use cases so I don't take up all the time. The second use case was with diagnosis. So there are so many personal and work-based examples I've seen of a delayed diagnosis. So as the person from the TED Talk mentioned, people are flawed, and occasionally, like, providers will make mistakes. We're all human. People are trying their best, but they will still make mistakes. And so you have the opportunity to use AI to speed up diagnosis and then present a diagnosis to a provider to then say, hey, this is what I think is happening. You now, as the expert, before again we go off and let the AI go rogue, you now as the doctor, as an expert, can you validate that this diagnosis is accurate? I'll give you a very personal example, which makes me very interested in decision making by AI. So I had to have a surgery last year because 2 years prior, a different doctor missed an MRI scan I was supposed to take. So if there had been a decision system to help this person do an MRI scan, my diagnosis would not have gotten worse in 2 years, and I could have prevented a surgery. So there's both like a cost to the hospital and a cost to me in terms of healthcare of this decision being made. And so the thought that came to my mind the moment I realized that was, hey, all you needed was something that will help you say, this person has met these criteria. And so here is a decision I'm suggesting for you. They need an MRI. Provider, do you accept or deny that this person needs an MRI? And then the decision can be made at that point in time. So there are so many benefits that I see to Cameroon adopting some of these AI tools. Of course, any tool can be used nefariously. So I'm not going to say blindly that, like, we've seen a lot of bias in AI as well. I used to work in HR, and there was a lot of bias as we worked through data science in HR with how people would get recruited, as an example. So I'll not naively say that tools can be used for evil, but there is a lot of possible potential for the use of AI in Cameroonian healthcare. And I think it might actually help us skip some steps with like, there's an assumption that I've had of, like, people would need to, let's say, like, continue like upskilling to get to the point of different nations, like, medical standards. But there is a potential for AI to even help us skip some of those steps by having tools at your fingertips that already provide you those standards, instead of you having to read 5,000 books as a doctor to then get to that point in time. So many advantages. I do recognize the bias, and I also do recognize that we might not yet have the technology to be able to do things, but we should be moving towards getting that technology. And that's it for me, and feel free to ask any questions.
Yeah, thanks a lot, Julia, and really thanks a lot for joining. We really deeply appreciate it, and would love to have you sometime talk about some of the impacts of this in our Cameroon sector. Mattel dropped a question in the chat, which I think is fundamental. I would think, or argue at least, that every country's data is probably their data mine, and us having the ability to synthesize our own data in our own language, for instance, having our own ChatGPT in our own mother tongue, in our own language, so that you can even speak your dialect essentially to, essentially have an interaction with, for instance, a large language model using your mother tongue. So I think every country's data is critical, but we still have, and one of the points I think Mattel is making in the chat here is we still even have challenges with data collection at the local, regional, and national level. So I think, Julie, my question, I guess my curiosity is, what sort of infrastructures or digital infrastructural needs do you think needs to be in place for AI to be efficiently deployed in Cameroon? I was trying to glance through the document, the document that was put out about the national strategic plan for the Ministry of, I think, telecommunication, the Ministry of Health, for the year 2030, I was trying to find what specific computing resources we have, but I haven't been able to glance through to the end. But I'm curious your thoughts in terms of what sort of digital computing infrastructure do we need to have in place in order to make this happen?
That's a good question. And I'm spoiled being in the US to not to worry less about this, especially because we have an information security structure that deals with HIPAA and helps with some of these things. But that is part of what I would say in the very first place. So a lot of places that have maybe suffered when you consider an entity like a country with AI might not have information security in place. And that's like, this is people's healthcare data. That's something that's indispensable. So making sure that when we are deciding on having what's the word I'm looking for, servers locally or abroad, information security and securing this information so it's not available by people outside of the country or within the country by people who are not the actual provider is very important. So having that, but also having the follow through when there are issues to punish people who violate these laws. So that's one of the things. And then the second part would be, so some places decide to go with local servers to store their data, and some places decide to work with other governments or other companies that might already have sophisticated enough tools to work for a specific government. And so that's a decision that the Cameroonian government would have to make with, like, do we want to invest in local servers or do we want to actually do things abroad? And these local servers now assumes that we have the capability to be able to build our own clouds based off of these servers that would be local. But one thing, so there's this more involved, heavier commitment when we talk when we think about, for example, like an infrastructure to have everybody's like medical information standardized. So I think that's where we're going with this question a bit. But there are opportunities that might not have to wait for that, right? So you saw the example of somebody putting things into ChatGPT and saying, these are the symptoms that somebody has. What might be happening? That doesn't require a healthcare, medical record system to exist. That requires like knowledge of, given these symptoms, this is what is likely happening, and then hopefully now go talk to a doctor. So I do want to separate those things because I think it's important for us to not wait for like setting up these like information security local servers versus deciding on foreign servers might take some time, but there is a lot of innovation that can happen quicker with providing a large language model with information about malaria or just diagnoses that are specific to Cameroon and as a priority, and then the rest of the world as a second priority, and then making decisions from there without requiring the full medical record system to exist. I'll stop because I see there are other points of view too that would probably be interesting to hear.
Yeah, thanks a lot, Julie. Really appreciate your remarks. Thank you so much. Dr. Polo, please.
Thank you, Ryan. Thank you, Julie. You actually touched on what I was going to say. Thank you for the right setup. So I think Julie is absolutely right. We should not wait to have all the IT system in place, particularly at the national level. And I think what we could do is exactly what she suggested. You need to have the data, meaning the knowledge. In the example she pointed out, if you know what are the symptoms, one can imagine to have a platform, even on WhatsApp, which is connected to an LLM. And if ChatGPT offers actually LLM agents, which can be connected to any platform using API. So you need to have the knowledge of what you want to achieve. And I think many of us here have it. We know how to summarize medical information. And on the other hand, you have a platform that is really accessible. And in the middle, the API to connect the question you want to answer and the answer that you want to see or you want your user to have at the receiving hand. So this is something that we are doing in Cameroon right now. This is a full disclosure. What I want to say is it's not so much having a platform. It's actually, at least in the context of Cameroon, it's actually changing behaviors, providers' behaviors. You have a platform like that, I have to say it requires a lot of education for people to use it. Because again, the fear of being replaced, the fear of how am I going to pay, qu'est-ce que je gagne using it, this monetary. So all of that are barriers. So we might have, like we have now, right now, this platform in Cameroon, and those barriers are what we are facing. So we have the tools, but you have to change behaviors. The other piece I want to talk about is really the data. If we cannot have access to data, local data, then we don't have a culturally competent platform to enable decision-making locally. And the issue of data in Cameroon it's a very important one, because people are still they do take note, it's handwritten notes. And I think that's where the opportunity is when we think about AI in Cameroon or in Africa, because everything is handwritten. So first you get the data and you get a human in the picture to review that data. So those are the 2 points I wanted to make, that there's a possibility to have those tools without waiting to have all the IT system in place at the national level. The second thing is changing behaviors of the people who are going to benefit from it. And the last piece is really looking at collecting data and having human reviewing the data, the integrity of the data. Thank you.
Yeah, thanks a lot, Dr. Poro. Really, thanks a lot for expanding on that as well. I see, Gilbert, I saw your hand was up, so I don't know if you wanted to share some thoughts.
Hi, Brian. Hi, everyone. Thanks so much for this amazing session. I had to pull my hand down because Julie literally touched on some of those points which I wanted to hang on. However, I just want to cue in to acknowledge the fact that AI is indeed a potential to help us transform our healthcare system. However, we must be mindful of the fact that it comes with a lot of preparation. And if we are not prepared, then AI, despite its potential, becomes a missed opportunity for us to leverage on what we want to do. Julie has already talked about the infrastructural aspect of it, which is very important for us to begin to acknowledge that Cameroon, a case in point, really needs to be up to speed with the kind of infrastructure that is required to drive this innovation in the healthcare system. Apart from those that Julie mentioned, AI doesn't operate in isolation. It doesn't happen in space. We're talking about how reliable are access to electricity, internet access for AI to be effectively deployed. I was just tracking one discussion in a certain WhatsApp group, and they're talking Cameroon is still lingering around a 2G, 3G network and all the like. But overall, is for us to think very strongly about the infrastructural aspect of it. Then I think, Dr. Former, you definitely agree with me that some of these innovations come with the greater need for capacity development. Do we have the readily available capacity to drive this change at a local level? So these are all things to consider, and how best not only to target the healthcare workers, how we can make this to be truly inclusive, to engage policymakers to embrace such an innovation, which is very important. I'm happy the minister from time to time visits this platform, and it's really important for policymakers to understand the relevance of AI tools and how their application is going to help accelerate the change we want on the ground. I think the last thing I want to say is really about ethical concerns about AI. For the past couple of years, I have had the opportunity to really attend very important global events. One of them being the World Data Forum. The World Data Forum, interestingly, which will be holding, I think, next week or so for 2024. But this is an opportunity for us to learn about what data is all about. If we do not tailor our data needs to really reflect the reality on the ground, we may be tempted to have a kind of a generalized perspective that will be generated by the AI itself. And so, like the last speaker, Dr. Polo, did mention, we need to invest in data. We need to invest in data management. We need to invest in curating our own data in a way that we kind of experience a digital shift or a kind of an operational shift from manual engagement, manual operations to a fully digitalized system. In that way, we can really boast of leveraging on the potential that AI offers. Let me just talk on this ethical concern hanging on the aspect of data privacy, the security of the data, who is accessing the data, how is that person accessing the data, what are the ethical consideration that must be put in place to ensure that the data is secured wherever it is stored. And so Julie rightly said, it comes with a lot of investment. Whether we think of having our own data system locally hosted, or we go with what is going to be happening globally. And when we choose the global option, then we become more vulnerable. Vulnerability here doesn't only mean the physical vulnerability, but even in terms of our data exposure, it is of prime importance to think about the data security, who is accessing the data and for what purpose. I'll end my contribution just with saying that AI indeed is revolutionizing the way we approach things in the healthcare domain. I will speak very briefly on the aspect which I am focusing on, which is on nutrition. We're using AI to model diets and menu plans. For instance, for patients, we are very, very comfortable to just move in when every infrastructure is in place, capacity building is ensured, ethical considerations are already put in place. It's easy for us to come in. If you tell us this is the patient, how do we model the diet for this particular patient? What menu plans can we generate for this patient? AI can easily do that when every other aspect is in place. Getting the age, the weight, the height, the BMI, the blood pressure levels, cholesterol level, and so on. All of this is immediately assembled, given that the data is already available, locally is contextualized, and that is where the real benefits of AI comes in. We need to invest and get ready for the benefits. Over.
Yeah, thanks a lot, Gilbert, for that really insightful remarks, and thanks a lot. I wanted to, and Dr. Kenji, not really put you on the spotlight, but I really wanted to ask your thoughts about some of the applications in clinical diagnostics, in particular, what you've been seeing in the horizon. I know Eric Topol in the video that Dr. Mono shared some insights, but I'm wondering your thoughts in terms of what you've seen on the horizon and some potential opportunities there.
Hi, Brian and everybody. Thanks. Sorry, I'm driving, so you may get some easy sound on the background. I want to say in the clinical pathology space, AI is really revolutionizing a lot of things. If I start with microbiology, the traditional way we did microbiology is, you get a urine sample, you plate it on a culture media, you read to get the colony count and look at the morphology and look at the color and everything. All that now has been upgraded. So now we have an instrument called the WAPS, where they've taken several images of the bacteria and they have been able to train an AI system. So once you put your urine sample into that instrument, it's going to plate it for you, it's going to incubate it, then it's going to take pictures of the bacteria and is able to give you an identification. of the bacteria. So it has really revolutionized the way we, do microbiology. And one of the things that we are doing at Stanford is at the level of pathology. If you imagine pathology, reviewing all those slides, being able to say that is a cancerous cell and all the like is very daunting. It's a very difficult skill sets to have. So what our team have been able to do is, take images over time of slides, and now they are training a system where you could just use digital pathology, where you take a picture of the slide and you run it through that system, and it's able to give you some diagnosis. So I think AI is the way to go. One of my friends was just telling me that she feels like the newer generation will not really get the basic concepts of science and all the like because of AI. I said, no. You know what? The newer generation, they're going to be smarter than us because AI comes as a tool for them to use. Take, for example, I had a meeting that ran for about 4 days. The transcript for that meeting was almost 300 pages. If I was to sit down myself to summarize everything, it would probably take me 3 months. But you know what? I break them into pieces, gave it to AI, and AI gave me quick summaries. Within 2 days, I was able now to get the summary from the AI now and make my own summary. So I think that's the way to go. AI for everybody, and the application I know is going to continue to expand more and more. Thank you.
Wow. Thanks a lot, Kenji. Thanks a lot for sharing that. I think one of Dr. Mono, one of the things, central themes that I've been hearing is how important it is for us to build quality data. Because if we don't have quality data, we don't really have anything to train on. And I think it's been a huge challenge for us because we really need to build that digital kind of infrastructure, or at least data center. I've looked at the document that Dr. Polo sent in the chat, the digital plan as well. I haven't seen that we actually have any higher computing centers. We don't really have any particular data centers and things like that. So I'm kind of wondering what your thoughts are. Where do we start from? In terms of beginning to build this kind, because we need to train. I think if we're kind of building that kind of data infrastructure, we need to train our own with our own data. So we need to have data that's customized for Cameroon and not biased towards the things in the West and things like that. So I'm just kind of wondering what you think, how you're processing this, and how you're seeing that we might leverage AI in our context.
Yeah, I'm a big believer that let the strive for perfection not be the hindrance for basic things that we can do. Yeah, Brian, I think I understand we need to build our own, which is the basis of where we need to start. But we already have a lot of things available that the young generation can use and they have access to. We need to make sure that the young generation that are growing up can embrace AI and not look at it as, they should look at it as a tool that they're going to be using from day to day. In Cameroon, the only way we can bridge this gap is partnership. Cameroon is similar to Nigeria, it's similar to Chad. We need partnerships, we need regional integration and sharing of costs. You do know a lot of these things, their cost is coming down with processors that are getting cheaper, but building and having these huge data centers are not cheap. We need to engage the government and the necessary ministry in Cameroon that is actually mandated to help us with this, maybe Ministry of Telecommunication, or I don't know. And we need partnerships, regional partnerships, let's say with Nigeria, with Ghana, with Central African countries, in order for us to have a unique data set. But if we can also partner with the West and safely partner in such a way that our data can be safely stored for us, and we can concentrate on, that's my vision, but others may argue against, and we can concentrate on using this information and feeding our own information into this data set so that we don't get information that is parachuted into Cameroon. I always say, I talk a lot, Brian and I talk a lot about science. I've always said garbage in, garbage out. Whatever you put into a model, you need to be careful. If a model is leaning towards the left, it's going to produce you left-guided information. If it's leaning towards the right, so you need to be able to understand the sampling that is getting into those models, getting us back to our basics of statistics, so that the model actually fits in information which is not politically or biased in any form. But getting into what I feel the way forward for our young scientists in Cameroon, healthcare workers, engineers, and those who are found in the telecommunication field, those who are in the computing field, there is so much out there that you can benefit from AI. There is so much that you can benefit from AI that it blows my mind, really. There are days I sit in my office, Brian, and I try to see how good the AI models are. I don't want to say this in public, but you feed in data, and you cannot imagine the time it would have taken me or the time it took me to get that synthesis of that data, and how much some of these AI tools are able to rightly stage a cancer for the patient, rightly pull out data to tell me exactly how to treat the patient. I will not be here giving you guys lectures every day. If the surgeons, the gynecologists in Cameroon could just put in the data form, even in ChatGPT now, I have a patient who came in with a mass in the breast, 4 centimeters, lymph nodes negative. Patient has no other symptoms. PET scans are all negative, or CAT scans, all negative. ER/PR status is this. How do I treat the patient? AI is going to produce you data which is 99 times better than what is done for those patients. AI will tell you that this patient does, or this patient has metastatic disease, does not need surgery. It's not going to line up surgery as one of its means of treatment. So right now in Cameroon, at the moment that we're talking, the application of AI in different fields is too important that we should ignore. That's why I decided that we talk about this, though we don't have a real certified expert. Improvement of diagnosis and early diagnosing our patients. That's some field where we can improve things in Cameroon. Personalized medicine, we can actually still use these models even from our phones back home and the little internet that we have. Enhancing treatment and planning for a lot of these patients. A lot of these models like Gemini and ChatGPT can help you. Streamlining administrative processes, they can do that for you. And even if you're back home, there are several trees that you hear about that people have. You don't know what products are. Even drug development and monitoring of different disease tracks and things like that. These are all things that we can do back home at the moment. Yes, let's invest on getting our own servers. Let's invest on all those things, but let's make good use and improve cost, reduce wastage that is happening in healthcare, improve patient outcome in Cameroon. That's the way I look at AI. And also help us with public health, designing public health strategies in the data that we have right now. And then we can use this in training and education. So Brian, that's the way I look at AI. I don't want the strive for perfection to be the hindrance of us accomplishing big things right now in AI. So that is my take. It's going to cost us a lot. We need government to help us with building those. We need private investment. I forgot about the private sector. Sorry. Yeah, I really forgot about the private sector. So look at, in the US, AI has existed. I don't know if you know about the Da Vinci robot. So in surgery, we used to go in surgery and do, but a lot of the surgeries that are done by neurosurgeons, it's planned. There is a robot that is there also. The Da Vinci is a huge robot that you can plan the surgical thing, and it actually helps the surgeon as a surgical assistant and even does part of the surgery. So there is, if we want to talk about the applications of these things, it's quite complex, but there are things that are being done in integrating AI that it blows my mind, really. I use it in my own little small way, but still in my small way in oncology, it has blown my mind. I think I share the information with you all the time. Some things I can't say, but it blows my mind how good AI is in gathering research, gathering new knowledge that already exists, preparing patients' chart, logging in records, things that are existing. It doesn't produce, in religion, we used to say God created from nothing, that ex nihilo. It doesn't produce from ex nihilo, but it's getting to the point when you train it, it can actually produce new data. Sometimes you need to be careful with that new data if it's not creating data out of nothing, if it's not hallucinating. But this is wonderful technology. The world is going to change in front of our eyes. Just in the next 5 years, you will not believe it. If you don't embrace it, then you would be left out. You will not be able to even practice. I know about medicine a lot more, that's why I'll talk about medicine. If you don't embrace it, you'll not be able to practice.
Yeah, thanks a lot, Mono. I totally subscribe to that philosophy of not allowing perfection be the enemy of good. So thanks a lot for sharing that. As we round down, I see there are just some two hands up, Ken and Julie, but also wanted to hear from you, Dr. Emmanuel Folak. I'm really also curious about how you've been processing this whole buzz on AI, and also how you're thinking about how it might affect the work that you're currently doing, and how it might shape the future. Are you seeing that people are really utilizing some of the resources that are available? I think one of the things that Dr. Mono mentioned was the fact that AI could potentially replace most of the repetitive cognitive task that physicians have to do. And also Dr. Eric Topol talked about keyboard liberation, which I thought was an interesting phrase. But I'm curious what you've seen as how you are processing this and how you envision this field changing in the future, Dr. Fuller.
Good afternoon. I think I will call myself a novice. I see people do a lot of things. But what I know, and this is my perspective, is that what we do repetitively, we can somehow program it and make even basic. Even with simple Excel, we can do a lot of algorithms that can stop us from thinking. At times, when you have a complex piece of job, there's a certain part of it that is something that you automate, that you can do. You can always say this plus this gives this, and you don't need to verify. It's always correct. And once in a while, you verify. So I think AI has a place. What I'm wondering, personally, I was going to come to the parking lot was this is, some of us who are like at zero, I don't know if anybody is at zero, where do we start? And some of the comments, I think Dr. Mono has mentioned them. What is going to be acceptable? And I see the few countries I've visited, some countries are very like protective. They don't want patient data to be out, this and that, and so on. And then in some remote locations, people are like using Google Sheets to collect some information and all of that. So I'm like, I really just want to learn where are the limits, what is acceptable. That is my impression. If not, when I learned epidemiology, I learned a lot. You see these complex statistical softwares do complex calculations, and we're explaining what that means. At times you can test some with basic Excel and get what it says. And apparently AI goes a step further, but it's like how much of it comes into our practical science. And then also in our context, at times you meet people, health professionals who are very good with their clinical skills, but the basic analytical skills or interpretational skills are not there. So I think facilitated AI will be of use to get us even to use what we have as elementary information. So that is just my take as a novice. Thank you.
Thanks a lot. Thanks a lot, Dr. Fuller. And I just want to call on Julie. Julie, where do we start from? Dr. Fuller talked about, and I know you might have some comments or some remarks to give, but when he said, where do we start from for novices? Where do we start from?
That's a great question. It depends on what access to. There are many places to start, and I think maybe the first thing I want to say is we cannot know everything. Like I know growing up, I thought, oh, I'm going to have all the knowledge in the world in the field that I'm interested in. And now as a data scientist, I still feel like I have less than 1% in the whole field. It's like maybe somebody as a doctor in one specialty not having knowledge in the whole of medicine. I would say though, practically where I might start So when ChatGPT was introduced, it's literally going to ChatGPT and ask it all your, I'm going to put in quotes, dumb questions. Like, I don't think that there are dumb questions. It's just like things that you don't know. So start playing around with it. You can do, it will even give you suggestions. Like it will say, do you want to plan A? Do you want to do B? Ask it anything. And then the only caveat I will say is, as you explore with ChatGPT or even WhatsApp's Meta AI, sometimes it will lie to you very confidently. So it's called a hallucination. So you can test it on things that you are already familiar with and ask it to, like just to see how it might lie, so that you're sort of familiar with the types of lies that it might say. And so you know what to take with a grain of salt or not. So the summary of that is ChatGPT, Meta AI, honestly, try any of those two, Meta AI and WhatsApp, try any of those two. Ask it any questions that you have. Like it could be, help me, something that, let me give you some examples of things that I've done. One of my siblings was overwhelmed and was like, hey, I need to update my resume. And I was like, I don't know your specialty, but I will use ChatGPT to update it for you. So I plugged in their resume and I was like, this is their experience, because I at least know, like, they studied here, they did this. I put it into ChatGPT and it updated their resume for them. And they had like, that was it. The next sibling followed suit. So after we learned, oh, this is applicable for people from Cameroon, etc., we now use it for resume, started using it for resume updates. Other examples, some people have used it to plan a trip. Some people have used it to find gift ideas. Some people have used it, like I do use it at work, but I'm giving you non-work examples of really basic things. I used it for a banana bread recipe the other day, and I've been using that recipe ever since. That you can ask it just things that you might not even be thinking that you should ask. You can ask for like at work right now, even if it's a work example, the specific use case is some of the people who are applying to our work, like the specific program I work on, they get stuck in the application funnel because they're not really motivated to make the dietary changes that they should be making. So we've developed like a ChatGPT equivalent that helps people answer questions like, oh, are you stuck here? How can I help you? So just like individual motivational questions to solve some life problems could be something that you ask ChatGPT. Now, the example I gave you with the hallucinations and the lies, there are questions that I've asked it with actual data to say, please analyze this for me. And then I'll look at the results and I'll be like, no, this is not possible. And so that gives you, trying some of those examples, I think will give you some notion of where will it lie and how much or how little to trust some of the results, which is why when I was talking earlier, I was recommending, like the doctors are the current experts. If a generative AI gives you specific recommendations, it's still on you, the expert, to take a glance and make sure that those recommendations are true, because sometimes the way ChatGPT will lie to you with confidence, it's not even funny. Like it will just say things as if it's the expert, and then you have to kind of gauge that it's not accurate. I hope that's helpful, but please feel free to ask me. Like I've said before, that I don't think that there are dumb questions. I have my own dumb questions in multiple fields, including medicine. So feel free to like find me on LinkedIn afterwards if you want to, and feel free to ask follow-up questions as you explore.
Yeah, that's awesome. Thanks a lot, Julie. As we round up, I see we have Kan and Gilbert. Kan and then Gilbert.
Thank you, Brian. I think the center of the discussion has actually been where do we have AI here in Cameroon, and where do we really think we can start from and how it can go. With the little exposure I have, I think we need to start from having electronic medical records. Whether it is a national system or it is individualistic based to each organization or hospital, I think that is where it starts from. We may like to start by rolling out electronic medical recordings in all hospitals. We're talking about the healthcare system here, so that in future, as time goes, some of these systems can be harmonized. Now, one thing I have noticed about AI is that it is integrative. That is one very big power of AI. It can be integrated. So which means even if you have data, somebody can develop an AI that can be able to use your data from, let's say, a hospital in Opita Central one day, and another one from the regional hospital Bamenda, to be able to model it and see how it can bring points together and raise a decision. So I think we need to have this data first, and that is where we start from. If we look at AI is more about bringing in data scientists that have that concept, and you tell them what you even want it to do. So they cannot just sit on their own and start saying, do this, do this. They need to hear from the clinicians, the experts in the field, that we need a software, we need an application, a system that can be able to use demographic data to be able to do this. Now, from there, we may start working with the cardiologists, maybe start getting images and storing them, maybe the age, the sex, the nature, and then after some time, all of this can be harmonized and then computed into a system that can be able to read it and use it. Now, the very big backbone of sustainable AI is having a team that is research oriented, so that as time goes in, we're talking about AI giving us data that is faulty. Even medically, we also have errors in diagnosing, like Dr. Mono said. So what happens is that you must have a team that is on seat, okay, that will use data to re-inform the programmers to reprogram this. Okay, we have seen that this is not giving up to 1. So rather, it should add up to 1.5, which means as the team keeps working on the background, the system can only improve better. So I think for me, I really want to learn more, and I think we may actually start from having electronic medical records in the country. Thank you, and over.
Yes, and thanks a lot, Khan. I agree. I think we've spoken about the importance of this for quite a while. I know Cameroon uses DHI2 for syndromic surveillance, but again, that requires power, electricity and power. So in the most remote areas, it might still be very difficult to capture data points from those areas. So I think we have a significant challenge with just power, just getting power and electricity and things like that. And I think that might be a handicap as well. Yeah, so I think that those are one of the areas where it's I mean, when I think about the entire landscape, I do think that if we can resolve this issue of unstable electricity and things like that, I think it might be a great step forward to at least implementing DHI2 in the most peripheral rural areas. Gilbert, please.
Hi, Brian. That was actually a legacy, and I don't know by what means I have 2 Gilberts in the platform. So, but if I can just speak on the point you've just highlighted, I personally led a team which worked on using the district health information system in Cameroon, and the challenges, as you rightly highlighted, access to real consistent energy, internet accessibility, and so on. Those were real-time challenges that we face. And sometimes, just like Julie did mention, the kind of data that is being pulled in from the expert end, the back end, because here you're talking about data, the front end and the back end. How you filter that data, how you clean up that data to make it usable, really relevant for necessary decisions is very important. And I just wanted to highlight something maybe might be good for Emmanuel Follak, just to say some of our friends, which I just mentioned in the platform, Dr. Insat Bernard, he's a medical doctor and also really extensive experience in mainstreaming AI in what he does. We'll be organizing a session. I don't know when, Dr. Former, I will share details with you once we have a clear agenda, so some people could also benefit to participate. But the session is just meant to bring people from different professional milieus to really share some of those best practices on how they integrate AI in what they do, be it from the medical field, from the logistics, and so on. How do they get AI to facilitate what the work they do? What are those best practices that we should be looking after to actually leverage on the use of AI? So I will leave it here and hand it back to Julie, whom we're very eager to learn a lot from her. Thank you.
Yeah, thanks, Gilbert. I'd love to hear from Sir Bernard as well. It'll be great to have you all maybe plan to give a talk. Maybe we'll take a last word from Julie, and then Dr. Mono might want to round up. Julie, please.
Thank you. A lot of like great thoughts, and then a few things I think I wanted to emphasize. So there are the possibilities are endless, and I know that we've been talking about a healthcare, like an EMR for Cameroon, and I do think that's important. And I think prior to the existence of generative AI, I thought that was the first step that we needed to be able to use AI in Cameroon. But with generative AI, there's just so much more that we can do without needing to wait for an EMR for Cameroon. And so I'm very optimistic about possibilities. I want to talk about a couple that we might not be thinking about. One of them is scheduling. So life happens in Cameroon, and there many times I've gone to see a doctor when they've been late, and there's an impact to everybody who's waiting to see this doctor. But we could use generative AI to help with scheduling so that there's adjustments to like people's appointment times based off of when a doctor actually shows up and what's happening throughout the day. So people don't have to commute to an office earlier than expected. They might not have to wait for 2 hours at an office, right? If there's like a clearer interpretation of like, okay, this is when your appointment will actually be based off of what has actually happened today. So there's no wait, or if somebody is actually really not available at this delayed appointment time, then they can reschedule. So there's the impact to the within healthcare, but for a non-healthcare purpose, which is giving people time. So the landscapes that we've talked about, like there's like the healthcare, there's diagnosis, there are things that we want to do in that realm, but then there's also just impact on people. There's also helping people who might have cancer with what do you do at home, right? Like you don't necessarily need to have an EMR to be able to support somebody through like, hey, I've encountered this specific issue with my current diagnosis while I am at home. I don't know what to cook, or I don't know how to deal with this specific aspect of my hair loss. This might not require like the whole EMR system to be set up. So I think I'm very enthusiastic about these use cases that might not require the time that it will take to build an EMR system to still have impact. And that's probably where a lot of the thought, where my brain goes these days with thinking about healthcare and AI is more on these use cases, without saying that the first use case of having an EMR to make decisions which I care about is not important. It is still extremely important. And then the only additional comment is I think there is an experimentation aspect that we sometimes overlook with new features, right? I think in Cameroon, I'm not very sure how much we experiment with new things we might be wanting to test out. And I say this just to help with some of the fears that we might have. So let's say that a doctor might be concerned. I think this is an optimistic concern given some of the other concerns I heard from Dr. Mpolo. But let's take an optimistic concern of, I am worried that this will not accurately diagnose. You do not have to deploy an AI without experimenting. You kind of have to decide, what metrics do I want to improve with this AI I'm deploying? And let's run a test with a control and a treatment and see if these metrics actually improve before deploying this change. And this is a way that keeps us a bit safer than just deploying something to a whole country or to a whole large population without like guardrails in place to make sure that it's actually doing the thing that you expect. Because at least from a US perspective, at least a third or less of experiments or new features that are launched are not successful. Like the company I work at has launched a whole bunch of previous company has launched a whole bunch of features that have led to either their failure or success in specific points. And so success is not guaranteed, but experimentation will help us to be better at iterating and making sure that we actually see the outcomes that we want to have. So the only point here is very excited about AI with the lens of let's make sure that we are intentional around experimentation. And it doesn't have to be to the point of perfection versus progress. It doesn't have to be this massive 1-year experiment. Like you can decide, I want to know within a month what kind of impact I have on this subset of a population, and then run an experiment with those parameters. So those are the only 2 points that I wanted to make as I concluded my thoughts here.
Yeah, thanks a lot. I totally agree with the point you made. I think that data safety and security in AI would be the most important moving forward. Just wanted to round up. I will just take some final words, maybe from Dr. Polo, maybe, and then Dr. Mono. But Dr. Mono, I have one final question before you give your closing remarks. Is those children who are in school, in high school today, what is your advice to them in terms of what they should be focusing on cognitively, creatively and things like that for the future? As you see where we are today and where, we're going to be 10 years from now, 20 years from now, what should the, children in high school, in primary school, high school be focusing on? Oh, you're muted.
So I think Julie actually said it. She just said what was in my mind. They have no excuse. They should download the free AI tools. Brian, there's no way you can get good at it by trying. You need to download them. They should get ChatGPT 3, which is free. 4.0, you have to pay. They should get Gemini. They should get Google Med. They should get Microsoft. They should get anything which is free, okay? And they should
I'm
play
worried
with
that
it.
their creative capabilities would erase.
No, I'm not. It's actually the next generation will need. Each generation, do you think back in the days, can you understand what Archimedes used to go through in order to just discover what he did? What Mendel went through and planting all the pills. You think I have to go plant those pills anymore? And I have to go raise those number of animals anymore and take the 20 years of my life to figure out what's going to happen? No. Science changes. Science changes like how it took us 50 years to get the human genome. 50. It takes me 1 day to sequence the human genome in my office. 1 day. One. It takes me hours to sequence a whole cancer genome with variations. 1 day. I have the data. Science is changing. We need to use our brains right. We need to embrace it. These children, my younger brother came to my house once. I cannot forget. I think I shared the story with you. His question was, Mono, what kind of ChatGPT do you have? I said, I have 3.0. He says, the best investment you will do this year. He's an accountant, but he told me, and the best investment you will do this year is to buy ChatGPT 4.0. That was why he was joking about it. And just play with it. I think medical-wise, I've played with it more than 99% of doctors in the US. I know what ChatGPT can do. Each time I go out with my colleagues, they say I'm an advocate of AI, unbelievable advocate of AI, because I understand it. I've used it. Even my oncology colleagues, we go out for dinners and we're talking. I tell them, I joke with them, I told them that, do you know that I can put in images of my scans and ChatGPT is going to give me an interpretation, which at times is better than what the radiologist said. You may not believe it, but truly it does. I tell them that there are times I can put in data, even erasing patient's name, and tell ChatGPT to analyze this data and tell me how much treatment this patient has gone, where it went wrong, lines of treatments that are missing, what else could be missing in this patient's data that we are not getting without putting the patient's private information. You realize that these kids need to play with AI, understand the depth, what it can do, understand what it's capable of doing. That's going to take them 50 to 100 years gap of knowledge will be acquired. they will be better than children 50 to 100 years back. So that, Brian, that is before I give my own conclusion, that is my advice to them. Let us not be afraid of technology. I know we are going to say that, oh, the skill sets for the future are different from the skill sets that are needed now. We need to embrace that. What will be needed for the future to move on? These children will grow in with AI. They are not going to grow in and trying to figure out how to calculate algebra. Their brains, before my mother got a phone, she knew everyone's phone number. So my mother used to tell us that I was the best student in math when I was in law. She knew everyone's phone number, but now she knows no phone number. She had a stroke, but now she knew no phone number the day I gave her, the day she bought a phone, an iPhone. She forgot all those numbers. It tells you your brain is good at personalizing things that are important. We have neurons that we use for other things. Let's not waste them for things that are not important.
Thank you, Dr. Mono. I will just...
Looks like you disagree with me a lot, but that's fine.
No, I just wanted to add that I think that understanding the foundation of anything is still important, really understanding the foundation of how the algorithms are even derived. That I think Julie mentioned about really even understanding linear regression models and how those predictive models are actually even being. So yeah.
There are two ways of learning, Brian. There's two ways of learning where you can learn retrogradely. There are times you will be able to do complex things and you will get to understand fundamentals. But I give my take. Let these children have access. Let them use it. By using it, they would discover things that you cannot believe. And they would solve Africa's problems.
Okay, let's hear from Dr. Polo. Dr. Polo, any closing words? I saw that you put in the chat some resources. I've heard about Google MedPalm. I hear they just updated it, but I haven't played around with it as well. But do you have any closing thoughts on the discussion today, Dr. Polo, please?
Thank you, Brian. I think the comments about Google MedPalm is really to address the concern that there might be some hallucinations with OpenAI, ChatGPT. Those models from Google, there is one from Google and the other one is from Microsoft. It's called Microsoft Azure. They are available for companies because it's quite a hefty price to get access to them. But they have been trained specifically on medical data for doctors on use cases. So they are more suitable if you want to basically have less concern when you and more confidence in the outputs they give. So I'm just going to end with this. What Julie had said, experimentation is the key. Anything that we do, my background is mostly in life science research. I'm a bench scientist, and I know when you have an hypothesis, you need to basically try it with the right parameter, of course. And I think that's where we should start. Someone mentioned, where do we start? I think experimenting is the first place. Then you get confidence in the tool. And more importantly, you have use case pertinent to your problems. So I think sometimes we want to go big, but we have maybe what can be seen as small problems, but let's experiment with those, get confidence, and you understand how the tools, what are the limitations. And I know, Brian, you had some concern and in the sense where people might lose their ability to think or to interpret data. Those are legitimate, but I want to say, as we think about the wonderful that AI can do, AI can also help us mitigate the risk. So there are a number of, at least here in Montreal, we have what we call the MISLA Institute. It's an AI think tank, and they are looking at solutions, how to basically track the misinformation generated by AI out there in health, in politics, and many other areas. So as we are using those tools, we should always be aware of the risk. And we should actually, as we implement the tools, think about what are the risks in my industries. I think AI is not something different than any other tools. If you use a tool, you have that responsibility. You need to be accountable as a doctor and even as a patient. do I have the mean to validate this information? So it's not something that's going to escape that radar or filtration. We have to be cognizant of that. And the last piece is, again, what I just said, you have to try it. Right now on WhatsApp, I know in North America and in Europe, you have Meta AI available on your phone. I'm not sure if it's in Africa right now. And I will end with this. We talk about a lot about AI using text input, but there's also AI using images input. And there's a fun example, actually, myself spent a lot of time playing with it. It's basically transforming images in fun images of yourself. So you don't have to go to see a photographer anymore. You can use on WhatsApp. I think it's available in the US. And from your WhatsApp, you just go on Meta AI, you put a picture of yourself and you say, put me in a professional suit because I need that headshot for, I don't know, to send it for with my CV. So just basic things like that for those of us who are based here are available. Just have fun with it. Thank you.
Yeah, thanks a lot. Thanks a lot, Dr. Polo. Always great to have you, and thanks a lot for your contribution. Dr. Mona, just your closing remarks for today. It really been exciting to hear different thoughts on this subject, and it's really amazing to hear how much this audience is current on the different tools and everything. But just wanted to hear your closing remarks, and I know after this we have a parking lot so we can discuss further for those who want to stay on. Dr. Mona, over.
Yeah, my closing remarks will be very simple. Brian, it changed as we're talking. My closing remarks will be that don't let perfection be the enemy of good. Africa, we should not. And we should really get these tools to the hands of the young generation. We should. Reason, I'll give you a story before I end. So everyone knows a child. I have my little niece, she's 1 year old. And she comes and she was born in a house where there is technology. Comes to my house, I could not believe I have difficulties manipulating my Samsung TV, which is a 3D TV. I have difficulties manipulating it. I get up in the middle of the night. She's watching TV. And I asked her, how did she do it? She said, my mommy led me. But she was able to put it on, go on to Google, and go on to YouTube, and Google one of these things that this child thinks. I don't know how she did it. That tells you the power of the human brain, the power of exposure. She was able to do that at her age. To play their little things that I don't know how they call them, but there's one name for it, I've just forgotten. She was able to do that. Get up alone, come sit in the parlor and do that. That's a 1 to 2 year old child. Imagine what AI would do in Africa. Imagine the exposure of AI and what it would do. It will do marvels. It would move mountains. We should not be afraid of it. We should embrace it. We should not be afraid of that. They will not learn all the Newton's theories like we did in physics. They will move from there and they'll fly rockets out of this earth from Africa. I'm too optimistic, but that's really what I think. And they should have it early. We should make it available. And for healthcare workers, don't be afraid of AI. I'm not afraid of AI. I don't think AI is here to replace me as a doctor. I've had this argument multiple times. AI doesn't have the emotions that I have. Chatting with my patients and them just getting to know me. The routine things that AI can do is going to take it off from my shoulders and make me a better physician. So let's embrace it and look at it as a tool that would help us in the future. So my home message, Brian, is just, I know we are worried, but don't let the strive for perfection be the enemy of good for Africa and for Cameroon. Thank you, everyone. And I think that's my take-home message. And Brian, what's yours? You've been the moderator, outro.
Oh, thanks. I just appreciate the Julie for joining and all the others who shared their insights here. I think this was a very insightful exchange. So thanks everyone for joining. And see you not in 2 weeks. I think.
Yes, I think we are going to see each other in 4 weeks because the next session falls on Thanksgiving weekend, which we'll be sending out a message online just to tell others that we would skip that session because of that. So in the next 2 weeks, we're going to skip that. I know Thanksgiving is in the US, but given everyone's schedule that I've checked, it's going to be a difficult session to host. So see you all in the parking lot for a few minutes.